Hey guys, it's Susie. Wanted to come to you tonight in case you have not heard through the grapevine today that Dr. Tobin has tested positive for COVID. What that means to you guys, he started having symptoms on Friday, which means when he was here Wednesday, technically he was contagious. Per CDC guidelines, because we're wearing our masks and we are wearing them at all times throughout the facility, except in the break room where we're 6 feet apart, there technically wasn't an exposure. So there's no quarantining of anyone here at the surgery center based on this. If you know something different, he told me he had his N95 on with a surgical mask over it, or a surgical mask on at all times when he was in the building. If you had exposure to him that was outside of that, please text me or email me as soon as possible so we can make some determinations to protect the rest of the staff. We've been on the phone today with legal, with the Department of Health, all kinds of lovely things, figuring out how to notify patients from last Wednesday. We are going to be notifying patients of the exposure, even though it technically does not count for an exposure, because even though they had no mask on and it was the aerosolizing procedure for them, technically he had his mask on and he wasn't doing an aerosolizing procedure, so they didn't need eye protection or a mask. Wanted to make you aware of that just so you know, and also wanted to stress the importance. I've put some information in the SMORE video or SMORE newsletter tonight to give you information from CDC. We are following CDC under every circumstance, but I also wanted to just reassure everyone and tell them that we're doing everything we can to keep people safe. Staffing is our biggest weakness right now. We are getting closer and closer to home. This is our first positive test of any of surgeon or staff here. Up to this point, it's been family members that have been exposed and people quarantining because of that. All those information and how the process happens, if that happens to you, is in the SMORE newsletter. But wanted to let people know that I need your help. We need to be able to function, take care of patients safely. We need to be safe to each other, safe to our patients. So the biggest thing that I need help with is I need people to wear their masks properly. I need them to come up over the nose. I need you to really wear your mask. I need you to not take them off when you're sitting somewhere else in the facility. Because even if no one's around you, you're getting stuff on surfaces. Heaven forbid you're asymptomatic for 2 days and at the surgery center before you get symptoms, or you remain asymptomatic and expose other people. I also need help for people wearing N95s. The white N95s are not protection for other people. It's only protection for you. It filters the air coming into you. It does not filter the air going out. So unless it's a blue or green N95, you have to have a surgical mask over top of it to be able to protect each other and protect our patients. I'm asking that people please, please, please do these things. It's for your own protection. It's for our protection to maintain the business. It's for our patients' protection. The last thing we need is some kind of outbreak being linked back to the Ohio Surgery Center. I will be following up with surgeons to make them aware as well, but I need help enforcing the fact that we really need to have masks over these white N95s to protect each other, and we really need to be wearing masks properly. The other thing I need help with is social distancing. I know we're all so sick of doing all these protocols. We're so sick of the lack of interaction in our personal lives, and we're getting more than 6 feet together when we're here. Anytime that it's avoidable, I need you to really not be doing it anymore. We really have to heighten our vigilance as people are getting more and more exposed. This is not good for our business. If we end up having so many people out, we cannot do surgery, or having surgeons out for 2 weeks at a time where we're losing cases. So anyway, your help would be greatly, greatly appreciated. Love you all, and talk to you soon.